doctors put two and two together. The fact that they were seeing in different locations, that cluster meant there was an infectious agent going around.
The report back on December 26 is to say, oh my God, these patients' samples contain genetic sequence most related to bat coronavirus.
The sequence of a pathogen is really important because that is what allows people to figure out how quickly the pathogen is spreading.
We had it from a good source that this was a coronavirus and that it was 20% different to SARS. I sent a really long text to George Goes, head of the CDC. I offered to send a team out there to come out there and do anything to support him.
He'd identified the virus, it was a new coronavirus, and that it was not highly transmissible.
Viral pneumonia has hit central China's Wuhan city. Authorities have reported 27 cases in total, 7 of which are critical. Patients are reported to have worked at a local seafood market.
因为我们肯定会，我们排查了嘛，排查了目前是跟非典没有关系，别的病原体正在排查。
Even some of the thoughts and speeches of Chinese citizens, they are now seen as signs of instability. Increasingly, even in WeChat, which is a private platform, that kind of so-called deviant speech would be punished with administrative detention or suspension of accounts.
If the government knows about a novel infection that meets the criteria within the international health regulations, the government is obliged by law to report that to the World Health Organization within 24 hours. The failure to report clearly was a violation of the international health regulations.
I mean, the notice says very clearly that you cannot spread or disseminate any information about this pathogen to the outside world.
I began to suspect there was human-to-human transmission around the 5th or 7th January. The respiratory department became full around the 9th or 10th January. The hospital told us that we were not allowed to speak to anyone. They wouldn't even let us wear masks. They say they were afraid of causing panic.
The Associated Press obtained some recordings of internal meetings by WHO officials.
I remember sitting on the floor at 3 o'clock in the morning on those calls.
We're going on very minimal information. I know it's clearly not enough for you to do a proper planning.
And as a respiratory pathogen, for us, it wasn't a matter of if human-to-human transmission was happening. It was, what is the extent of it?
We've all been here before in 2003. This is exactly the same scenario in this update from China. Invasion are good intent. If eventually something happens, there will be a lot bigger problem.
A really pivotal moment comes around January 8th when, they hear that the Wall Street Journal is about to report that Chinese authorities have identified a novel coronavirus. And this is information that the Chinese authorities have not told the WHO. Those concerns are not something they ever aired publicly. And instead, they basically deferred to China. They said, China says that there's this number of cases.
We believe that they can also contain it.
New cases have stopped after the market was temporarily closed. There is no clear evidence of sustained human-to-human transmission. The extremely rapid investigation shows the increase in capacity that China has acquired.
It could have publicly challenged China, or, and this is what WHO decided that it would do, to actually work with China behind the scenes to try to coax them to cooperate.
Ultimately, the impression that the rest of the world got was just what the Chinese authorities wanted, which is that everything was under control, which of course it wasn't.
Once the Chinese authorities confirmed it was a coronavirus, at that point, it seemed absolutely ridiculous that we couldn't release the data. We posted it on Virological, and I put a tweet out saying, here's the first genome sequence. So the sequence release was a key moment because it told people, right, this is the pathogen, this is what it looks like, and now we can start.
A Chinese tourist in Thailand is the first confirmed case of the new pneumonia virus outside China.
Researchers in the UK then quickly did modeling to figure out, oh, you know, if there's these cases that are showing up outside of China, how many people are actually infected in Wuhan? So what they found was pretty alarming. It showed that there were probably thousands of people infected in Wuhan.
Every day, there were several hundred people with fever arriving at our emergency department.
The severity of the disease was shocking. I mean, these patients, they were rapidly deteriorating into multi-organ failure, admission to intensive care unit, a high mortality.
On January 14th, China's top health official, Ma Xiaowei, told the country's public health institutions to prepare for a possible pandemic. They were saying things like, because of upcoming travel for China's biggest holiday of the year, the Spring Festival, means that this virus could be spreading widely.
现有调查结果表明，尚未发现明确的人传人证据，不能排除有限人传人的可能，但持续人传人的风险较低。
So far, with the current virus, we have limited human-to-human transmission.
What typically happens that in the run-up to the Chinese New Year, close to 300 million migrant workers leave the cities where they worked to return to their hometowns to celebrate the Lunar New Year with their parents and loved ones. The Chinese government made the decisions to hide the news so that the Spring Festival migration can proceed without any panics. It was unnecessary. They tried to convince district-level officials to cancel the banquet. They refused to do it. My guess is that the order to not do anything unusual came from the very top, you know, some very senior level officials in Beijing.
目前的这个资料表示呢，它是肯定的有人传人，所以呢，这个现在可以这么说，是肯定的有人传人的现象。
Doctors from Insight were describing it as SARS. Zhong Nanshan is very respected. To have him go on CCTV to disclose this, to be the first person in China to say that this is what was going on, was jaw-dropping. And that was when cases started to skyrocket in Wuhan.
至1月20号18时，境内累计报告新型冠状病毒。
January 20th is the dividing line. Before that, the Chinese could have done much better. After that, the rest of the world should be really on high alert and do much better.
Inside Wuhan, the people knew what was going on. Everybody was seeing the bodies being pulled out of apartments.
I've described it previously as the worst cover-up in human history.
及时向世卫组织及相关国家通报疫情信息。
By the time we knew that it was transmissible human to human, I think the cat was out of the bag. It had already spread.
And we will continue working to get the information we need.
At the end of the day, the WHO is owned and operated by the sovereign states of the United Nations, one of which is China, and a very important one at that. And so where I get concerned is that the word independent is simply not really accurate. This is not an independent organization nor an independent investigation.
I don't think it's clear right now exactly how history is going to view this pandemic. It's clear that there were mistakes that were made, there were clear delays, and many people did suffer the consequences.